Hello everyone, I hope you all are well and safe at home. So first of all, thank you so much for being so patient. I was meant to do this Living with Acne episode 6, especially with the scarring one last week. But because of it was Eid last week, so I couldn't manage to do it. So we're just going to touch that today. Now, I'm sure you all are aware that acne and scarring is a very big chapter. So I'm unable to cover everything today, but we will just touch base. And then I think we may need to do 2 or 3 episodes purely on scarring and how best we can achieve the results. So before we go on to what we can do about scarring, let's talk about what scar is. And I'm sure you all are aware that in the previous episodes, we have already covered about what acne is, what happens, what you can do at home. And then if scarring happens, then that's the time when you have to see a dermatologist, or before that, when you know that it's going to happen. So scar basically is an area of a tissue that kind of develops in response to a trauma. So trauma can be anything. It could be a scratch. It could be an injury from outside. It may be a surgery, or it may be a disease, maybe an acne. So anything related to that, anything which causes trauma, skin tries to heal. So scar does not only happen in skin, but because skin is visual, so you see the scar, and that's why it puts a big impact on you. Scarring happens in every organ of our body. So it's a natural healing process. In skin, we call it's just a tick, or it's just a mark which you see. Now, again, it's important to know that what happens in this process. So naturally, when your skin gets a trauma, your body starts the healing cascade. So in an attempt to heal that area, it starts producing a protein or a collagen. Now, ideally, it should produce how much is needed. But because it's a damage, so certain situations, it can produce a bit more than what is needed. So ideally, the scars should be flat. They can, or they should get pale with time, depending on how much or how bigger the area of injury is. So if in certain situation, your body is producing more collagen, the scar becomes more prominent, swollen, or something what we call hypertrophic, or a keloid. Now, keloid is a type of scar. Not every scar is a keloid. If that happens, they are the stubborn and difficult scars to go away, and we may need to use different treatments. I see this a lot in my derm clinic, and I use a lot of intralesional steroid. None of the scars we ever guarantee that you will have 100% recovery. So naturally, yes, if it's a small trauma, your body has an ability, and with other things you can get rid of a lot of scarring. But having 100% recovery is actually very difficult, and it's not one of the one of the possibilities. So many people, when they come and ask about what they can do to get rid of 100% scarring, the most important thing is to talk about it, what happened, and how you can reverse something which is irreversible. So that's what happens in scars. Now, there are different other types of scars. Before we go into further detail, let's talk about in acne, one of the questions which many people have asked, that does it matter what type of scar in acne you have and how that scar is going to respond to the treatment. So yes, certainly it does matter, because in acne you have different types of scars. We're talking about ice pick scarring to box scarring to hypertrophic scarring to pitted scarring. In simple words, these types of scars are more because for a dermatologist like me, or maybe an esthetician or a cosmetologist if you're seeing, purely because the treatment is going to be based on how deep the scar is. So for example, if I'm seeing a deep pitted scar, or a scar which has got quite deep rolling edges, then I need to know that there are multiple. So I know that there are multiple treatments and multiple different types, maybe like a chemical peel I need to add on, maybe I need to add on a microneedling, rather than just one-off treatment. So all of these types are important, and the number of treatments you need, it again depends on how bad and how deep the scars are. So yes, that is one of the biggest question, one of the biggest problem people they struggle to understand with. Now, the other thing which you need to understand that when there is a scar which has already happened, if you start scratching that area, now your skin naturally needs to breathe. So skin is quite light and it has a breathing space. So ideally in that situation, when you're scratching that area, so if I start scratching one specific spot on my face, now the layers of the skin gets further trauma because of the nails. And the skin then stops breathing at that area, and there is a lot of pigment stuff that happens. So if skin stops breathing, that area stops rejuvenating, and also the skin struggle to get rid of extra cells. So cells they start packing on that area faster, and as a result something what we call, and then the injury is kind of more. So it's like a catch-22. You have an injury, you're trying to pick that area, causing more injury, and then when pigmentation happens, which means the color changes, it's very difficult to get rid of it. So something what we call post-inflammatory hyperpigmentation, it's one of the most difficult things to get rid of. So in acne, you need to understand that maybe you have like a background old spots, and then people they get new spots. Certain situations when you are very going through stress for different reasons, or especially in pregnancy, in breastfeeding, and these type of and especially teenagers when they go through exams and these things, they have further, it's like a more stress happening in their body. So acne process is faster. So it is possible that they can have an old scar, and then and then they have a new lesion, and so at the same time it's like an acute on chronic acne, which means acute is like active, chronic is like a long-standing one. So in that situation, it's very important to know what procedures you're going ahead with. Not everything needs a microneedling. If there is an active lesion, I'm not going to microneedle on that area. Similarly, I'm not going to put a chemical peel on that area. So that's really, really important. Now, the other thing is that what are the products available which you can do? There's certain products available over the counter which you can use. I usually divide all treatments into different categories. So first is the topical treatment. If you go through all the previous episodes, we have discussed a lot of treatments already. Something like salicylic acid, I've already discussed. What products you can buy over the counter. It's quite good because it takes away a lot of dead cells, and the pores, it unplug the pores. So if the pores are clogged up, the skin underneath is again struggling to breathe faster. So that's kind of, you need to understand that. Then we've gone through other products like microneedling. I've already mentioned that. It's a good thing for acne, scarring. I use a lot of microneedling. But one thing you need to understand, that first thing, you have to prepare your skin. So first of all, you have to go through, so maybe see a dermatologist or a doctor. If you have an active acne, we need to control that. So I use a lot of medical grade skincare. And retinoids, which are again the topical creams, I have already done an episode on retinoids. So if you're not sure, you can just watch that. And that also works on a lot of subtle scarring. So if the scarring, depending on if the scarring is like on the top layer of the skin and it is not gone in the deep layer, it's a superficial scar. So simple topical creams, they really help and get rid of a lot of that. However, if the scar has gone deep, like the roll scars or the ice pick, sometimes that can go deep in the same area, then you need further treatment. So further treatment other than the topical, yes, microneedling, chemical peels, lasers. I do a lot of lasers as well. Now, one thing you need to understand that I see many clients, sometimes they go and they read about a chemical peel and they go and just get a peel done. Now, somebody who is my skin type, I'm quite brown, so I'm skin type 4. So skin type 4, 5, and 6, they are at a high risk to have further damage if the skin is not prepared. So in acne, you have a scarring already happened, and then you go through, you don't know what products you need to use, and then you have just one-off procedure done. So if the skin preparation means that if you're not exfoliating your skin on daily basis, you can go through a good exfoliator. You can buy salicylic acid, benzyl peroxide, and these type of things. They do work. There are a lot of alpha hydroxy acid creams available. You can buy over the counter. The ones which are available over the counter, they don't have a lot of strong strength, so it's quite safe to use. So that will get rid of a lot of dead cells and subtle pigmentation things. So it will prepare your skin. So whenever we use preparing your skin, this is exactly what it means. As a dermatologist, I go quite deep and I prepare the layers quite deep, and that's the reason the outcomes are better. Now, other than that, the deep peels, please don't use it at home. These are all professional ones. Alpha hydroxy peels, again, the depth of the peel, the strength of the peel, that's what is needed to know. So you can't use every peel at home, and don't try that. The other thing is that microneedling, we've already discussed that sometimes people go for derma rollers and they do it at home. You have to be careful. You can't use the same depth of the needle at every scar. It does not work. That's important. What are the things you can do? So lactic acid is quite good. And again, I use a lot of lactic acid peels. One thing you can do is, it's quite cheap method. So apple cider vinegar has got natural lactic acid. You can use it at home. And it does get rid of a lot of scars if it's really superficial. If it's deep, yes, you may need to persevere with it. So it only depends on, where exactly it is. Now, other things, somebody has asked about the dermabrasion. I'm not a big fan of dermabrasion. Somehow or other, I don't see good results with that. Dermabrasion concept is simply to exfoliate the skin. So, you can use these products at home, but dermabrasion, it's just my personal choice. I'm not saying it's a bad thing. I don't use dermabrasion. The other question was, somebody has asked about dermaplaning and scarring. So dermaplaning has nothing to do with scarring. Dermaplaning simply means that I'm using a surgical blade and I'm literally taking off the dead cells. So at the same time, when I'm taking the dead cells off, I'm taking away a lot of subtle hair from the face, and I'm not doing anything. So it does not work on the scars at all. Yes, maybe the dead cells which I'm taking off, maybe that will kind of work on the wound healing process, but it's so superficial. I'm not going deep, so I'm literally taking the surface off. And scar, usually on the surface, especially in acne, usually it's not on the surface, it's a little bit deep. The different layers of the skin, we've already discussed that. So lasers, yes, I think lasers is again a lengthy topic. We can talk about lasers one day. Now, the other thing which you need to be careful, that scarring can also happen because of sun damage. So again, back to the basics. Sun damage, it's a UVA, UVB light. B causes burning, and A is mean aging. So you don't need a lot of exposure to have a UVB. UVB is very fast, very quick. And that's why when you go away on holidays, when people, they suddenly get the sunburns, and that's because of the UVB. It just strikes faster. So when there is already a scar present there, and you're going away without using a sun protector, then it will make your scarring worse. Also, if you're going through a treatment for scarring, especially if you're using, like, say, sometimes like for keloid scar, I'm using an intralesional steroid, I'm using a topical steroid, really potent, strong creams. They are anti-inflammatory, but at the same time, they thin the skin as well. So using these creams and going away on the holidays without using an SPF is not a good idea. It does not work in repairing the skin. It actually works in a different way. So that's really important. And SPF, okay, so there are lots of questions about SPF. As mentioned, I will do a separate video on SPF. Rule of thumb is SPF is just a sun protector, sun protection factor, and many people call it as a sunblock. So the numbers on the bottle, it tells you how long it's going to protect you in the sun. So if, say for example, so minimum you should be using an SPF 30. So somebody like me, as a brown skin, I have a natural protector inside my body, which is a melanin. So if I'm putting an SPF 30, I'm actually quite safe. But if I'm putting an SPF 20, 10, it's not safe for me. But somebody who's really white skin, maybe skin type 1, if they are if they are using an SPF 30, that's not enough because they don't have a natural, they have a fake melanin in their body. So pick up the right one, and when you're picking up, I explain this all the time, just turn the bottle and just make sure that it is FDA approved products you're using, which simply means that the clinical trials have been done and they're quite safe products, and the chemicals which they actually use in these ones, they're not very toxic to the skin. So I think we've kind of done. So the rule of thumb is once the scarring happens, it's difficult to get rid of it 100% depending on how deep it is. It's just a bit of a summary. Yes, in acne, when you know that the active lesions are happening, that's the best time. So if we can prevent the scars, that's the best way. So that is the time when you need to see your dermatologist. The retinoids, topical retinoids, yes, they are really good. You can use it, but again, that causes a lot of itching and irritation. Plus, it causes a lot of dryness in the skin as well. So dryness then will make you itch that area, and that can then, again, the nails can cause further damage. So just be careful with that. So simple things, make sure that you exfoliate on daily basis. Pick up an exfoliator. With acne, I've already explained that. And oil control is really important. So no products with the oils, because the stronger or the more oil you have, it does not make your skin breathe, because oil kind of makes a layer. And anything if you put on the top of an oil, it will struggle to sink down. So that's exactly how it works. And you're going to use a lot of your products as well. So as exfoliation, SPF hydration is important. So when you're going out, at the moment, the broad spectrum SPF, they cover you from UVA and UVB, and also they have a lot of hydration mixed together. So usually they're okay. Drink plenty of water, and don't pick any spot. The habit reversal and things which we have already discussed. If you struggle if you struggle anyway, so then you can look into getting camouflage creams. They're available, and they actually have different colors. You can actually use it's like a concealer type of a thing, and you can use to cover that area as well. So I think I'm done for today. We will talk a little bit more next episode. We'll talk a little bit more about chemical peels and how I use it to treat acne scars. So until then, I think I've covered most of the questions which people have asked me. And the only one question, yes, somebody has asked me about the pitted scar, that why people get pitted scars. So as I've mentioned again, that usually a skin type 4, 5, and 6, they get more because of the our genetics is very oily anyway. So what happens is usually if you don't have a very strong skin, if you lose the skin pad. So imagine that this fullness of the cheek is because I have a skin deep fat pad which is supporting. So it's like a matrix underneath, and everything else sits on the top. So as we age, the natural beauty cycle, triangle changes. So everything's face starts kind of drooping down. And that's because the first thing we start losing are the cheek fat pads. So if I don't have a fat pad there, which means all of this, so if you see, all of this will kind of drop down. And then there is a scar on the top, so that will kind of go deep in, and this will look like a pitted scar. So for these ones, what you can do is people usually go for collagen type of thing, strengthening thing, rejuvenation treatment. We also use some fillers to fill these pitted scars as well. But the whole idea is to pull the skin back and to give some strength, maybe that areas or maybe this area. So fillers are really good for that. And then whatever the scars are on the top, you can just fill that in. So that was the last question, and I don't want to keep it very long. So until next time, if you have any questions, send me a message and I'm happy to do it. Until I see you next, stay safe and enjoy your day. Bye.